Thank you. That was Sanjeev Bajaj and V.S. Parthasarathy here at the Enterprise Innovation Summit 2021. Now, this is day one. We have 2 more days of information-packed sessions coming your way, and Enterprise Innovation Summit 2021 is presented by Yota and our gold partners Commvault, HP Enterprise Unique Solutions, Infoblox, Tata Communications, Veeam, Versec, the Uptime Institute, and Zoom. Now, our next session is all about data protection and the needs around this domain in modern day business operations. So please welcome our panelists, Atanu Roy, the Group CIO at Biocon, and Sandeep Bhambure, the Vice President and Managing Director for Veeam India and SAARC. And leading this discussion is Rahul Neel, our editor here at DynamicCIO. So over to you, Rahul. Take it away.
Hey, thank you, Ashwin. And once again, good evening to all the friends who are joining us here today. Now, we have a very exciting fireside chat coming up with two great friends on a topic of modern data protection needs and benefits of continuous data protection. Now, before we delve into the conversation, I think I'll spend a couple of minutes to just set the tone for this conversation. Given the uncertainty and disruption the industry has gone through in the past 15 to 18 months, it would be very naive if businesses treat data protection as a tertiary priority. The systems and network administrators have a serious work cut out for them to protect physical and virtual machines both inside the data centers and also in the cloud. Not just that, they have mobile devices, including all the endpoints, followed by the SaaS services, for example, Microsoft Office 365, Google Workspace, Salesforce, and also the persistent data created by the Kubernetes and container workloads. Now, the CIOs and technology leaders have to navigate the breadth and depth of continuous data protection challenge and seek solutions what's right for their business. We also need to learn the unique requirements that each workload presents to us, then explore commercial solutions, which includes the backup hardware, software, and services available to protect these data resources, including the advantages and disadvantages of each of the approach. Now, we need to learn the workload types that our organization should be backing up. We need to explore the hardware, software, and services we need to be backing up our data, understand what's wrong with our current approach, pair our backup workloads to the appropriate backup system. All of these things are okay, but interestingly and ironically, even when we have access to a lot of technology options, I was going through the Veeam's recent data protection report, which shows a high rate, which is 58%, where backups fail and leave the data unprotected. I mean, that is quite ironical, to be honest. So there are two main reasons for the lack of backup and restore success. Backups are ending with errors or are overrunning the allocated backup window. And secondly, restorations are failing to deliver their required SLAs. Okay, I won't reveal much and will let the experts do the rest of the talking. I have with me today Atanu Roy, CIO of Biocon Group. Atanu comes with a very deep connect with the healthcare and pharma industry and is a very seasoned technology leader. Also joining me in this conversation is Sandeep Bhambure, Managing Director, Veeam Software India and SAARC. Welcome, gentlemen, to this edition of EIS 2021. How are you doing?
Very nice and happy to be in this conversation.
Thank you. Happy to share this platform with Atanu and yourself, Rahul. Wonderful to be here.
Thank you, Sandeep. Thanks. Pleasure is mine. So let me begin with Atanu. Pharma companies, they have gone a while. I mean, they've gone a long distance through a visceral change as far as digital adoption is concerned. I would like you to give us a few key technology trends that hold the potential to shape the future of the industry that you work for.
So, Rahul, I would like to give also a context to it.
Please do.
In pharma, for patients, patient safety is the most important thing. And everything actually revolves around that. And what it means is that right from the supplier to the manufacturing to while it is goes to the patient's hands, the pill or the injection, whatever it is, or the ointment, we are supposed to record each and every ingredient which has gone into manufacturing that particular pill and in what conditions it has been manufactured, and is it really of the right quality, and does it have the stability. When you see that expiry date, when it was shipped in from the factory, it was on a certain date, it met the quality conditions, but when the patient is consuming it, is it having the same efficacy?
Absolutely.
So all these things are extremely important because the patient safety is paramount. And for complex medicines, a problem in any of this can lead to casualties. So it is a very serious thing. And pharma companies over all these years have been maintaining all these documentation on pen and paper. Now that is obviously very cumbersome, and with huge amount of increase in volume of production, huge variety of products which Indian pharma companies make, this becomes increasingly difficult. And hence, that has been one of the major drivers for the digitization and digital transformation. Apart from that, it was to ensure data integrity linked with this, that whatever is getting recorded, is it the real thing? And is that what has happened? So that you don't leave anything to chances. Whether knowingly or inadvertently are people typing in wrong data or entering wrong data. And to prevent that, data integrity and digitization of the complete chain is extremely important for pharma, and it is getting done because it is geared towards the need of patient safety, which all these years through manual recording was possible, but it is not possible any longer with the increase in the volume of production, as well as the variety of products which Indian pharma companies make. You can see even these COVID vaccines, the volume of production which is there to keep track of ingredients which goes into each and every vial is a complex thing. So that is the necessity of it, and hence the driver for the complete digitalization of the whole value chain. The other dimension which comes is data privacy. For now, we are getting into we are integrating with the patient ecosystem. So to a large extent, because the pharma supply chain and the healthcare supply chain gets integrated together, and while to ensure patient safety, we get the patient data, but it is very confidential and the privacy has to be maintained. The other part linked to this is the part of now that you have got everything digitized, you are increasing your risks manifold from a cyber threat perspective. And if it was less digitized, it was easier job for us. Now our footprints are extended, and hence the threat of cyber attacks, and it can paralyze the whole value chain. So it scares us that much, and therefore the necessity of backup, restoration, quick restoration, all those things become so much important. But these are the various dimensions in which we are operating, and this is what is driving the digital transformation in pharma. Apart from this, obviously the fact of increased productivity, better quality, ability to do drug discovery faster, and that is being seen. The COVID vaccines people were able to discover much faster compared to the earlier vaccines which has been made, and similarly it is happening in all other products. So the usage of data for taking better decisions in terms of better drug discovery, increasing the productivity in plants manifold. For instance, in COVID itself, the second wave, the volume of production of those critical drugs in month of Feb and March was very less because people thought that it is all over. And suddenly in April, when it picked up with the same raw materials,
Right.
because your raw material supply chain was limited, getting it from various other countries. How could you increase productivity to make the finished product was a very important thing. And that all deals with data. So these are the digital transformation, digitalization, and the use of data to take better decisions, which helps in drug discovery and overall increase in productivity, uh, tracking the whole supply chain. For example, the remdesivir, which was being sold during the second wave of COVID, many of them were not authentic. Ability to track that and locate it means that there has to be significant amount of digitalization and data traceability needs to be maintained. So this is the overall context in which we are operating.
No, wonderful. I think it was prudent on your part to take it back to the roots and why is it more important, because and the way you explained both for the secondary and the tertiary domains in a pharma value chain, which also includes healthcare. Fabulous. Thank you, Atanu. Sandeep, you heard Atanu very carefully, and Veeam as an organization is at the forefront of offering continuous data protection, which Atanu himself said is very vital part of the overall digital transformation journey. So, can you explain to us what is continuous data protection and why is it important for enterprises which are on their digital journeys, and how does it ensure availability of data all the time? You are on mute. Can you please unmute yourself?
Yeah, sure. Thanks, and thanks, Atanu, for setting the stage and explaining the context. What I could pick up from the conversation is three things. One is the pace of digital transformation, and which resonates with the industry, because every other organization, healthcare or non-healthcare, today is talking about accelerating on their cloud journey. Atanu spoke about the proliferation of data and the origination of data and the kind of data organizations are trying to capture, particularly healthcare, when you're talking about the pills and the expiry, the ingredients and so on. So it's really kind of creating a huge deluge of information, which is business critical. You can't say that this is not important for the business. And finally, it was also about the time to market, because when we are depending on technology and digital transformation, we're looking at how do we accelerate our business, how do we increase our revenues, and while we control the risk, because obviously when we commit to the digital transformation journey, there is a fear that what happens if the data is lost. So Veeam continues to be the leader in backup. We are the most trusted provider of backup solution that delivers on cloud data management. And I'll not spend too much of time on continuous data protection, but to kind of lay it very simply, uh, it is basically the ability to reduce your RPO to near zero. Okay, which means that organizations today are talking about zero data loss. So far, the expectation of IT from backup solutions was just to protect information or help in recovery or restoration, do DR, and all of that. What we have done in the latest release, which is V11, is we have extended the platform to deliver on the capabilities of continuous data protection, so that organizations can protect their information and ensure that there is zero data loss in case of any eventuality. And we have been able to deliver these capabilities for virtual environment. Okay, so not only now do you have the ability to have RTO, which could be in a few minutes, which is how much downtime can an organization afford for their applications, but at the same time, you can also expect more and say, okay, I will not accept any loss of data, and hence my RPO needs to be near zero.
True.
So as we build the platform to extend on the capabilities, that the customers are expecting from us, we have been able to deliver not only CDP but several other capabilities to extend the backup and availability platform. And the reason being that backup is no longer, just an operational job. Atanu spoke about the pace at which organizations are adopting IT. And you were pointing to a report where it talks about 80% of organizations face an availability gap. Almost 60% of the respondents in that report, in the survey suggested that, they have not been able to recover the data. Either they are not able to back up the data on time, or they are not able to restore the information. So these situations are throwing a lot of challenges to the business, and we've been trying to address by going beyond the traditional boundaries of backup to help not only in DR and restoration and CDP and so on, but also extend it to cloud data management.
True. True. Yeah. So that's a point where I will probe you a little more, as we go on. Excellent explanation of how gradually even the technology producers are trying to understand the demand from the industry and not being very straitjacketed in their solutions approach. So Atanu, in the first answer itself, you had covered a lot of things that I wanted to ask you. However, I will still rephrase some of my questions. So you very well said that unlike many other sectors, pharma sector has to deal with a very high degree, very critical IP and sensitive data. And with automation and digitization sweeping across, there is an inherent risk of exposing that data, and data safety therefore becomes a very paramount concern for a CIO. So can you please let us know kind of typical threats that a pharma and healthcare sector faces in the realm of data security, and what has been the impact of pandemic on the threat landscape?
So I think the threats which pharma industry faces are very similar to any other industry. I don't think it is anything different.
Different, yes.
But what makes it more vulnerability for pharma, and where it impacts us even more, is that we don't want, again, it goes back to the same thing of patient safety.
Mm-hmm.
So if somebody is able to get into our systems and change our recipe in the production line, it can kill many people. So it can be it can be a sabotage which can be of enormous proportion.
True.
And with huge amount of automation, it is very much possible that somebody from externally or internally who would want to sabotage something can do something like that.
True.
Can change the encrypting systems, and making a ransomware is easier, is that way better. It stops your operations. But if you change the formula of a molecule or a product, and it will then, and it gets, full thing is automated, so the production happens as per that, and you release batches, and then it can kill people. So that makes it the industry more vulnerable. But the threats are same as where else, and hence the protections which we need to do are, I think more from that perspective, we need to be more careful.
True.
Second part is that from a pandemic perspective, the industry suddenly matured with doing many operations remotely, which was earlier thought that it cannot be done. Means many things related to manufacturing. People can do work from home for my job or many other corporate functions job. But in manufacturing, quality, people started remotely operating various elements of the factory, and how to do it in a very secured manner.
True.
Raise the information security paradigm many notches higher, and that helped us to evaluate and adopt multiple solutions. It also opened us to many more risks, which I think the industry, addressed them suitably.
Great. So another extension of this, if I can stay with you for a couple of more minutes, another extension to this, which Sandeep referred to as cloud data management. Now, proliferation of cloud is a story which every organization has to manage. I mean, that is something which is unstoppable. So, I mean, where do you feel challenged in cloud data management, if at all, or if you have managed it very well? Both ways you can answer my question.
So, especially in our organization, we have not gone significantly into cloud,
Okay.
and we have not used that. But what I see is that going forward, it is going to be intrinsic part of any pharma company's journey, because um, that is what would help us to respond with speed and agility.
True.
And that is something which needs very serious evaluation, and at the right moment, companies like us would have to move many of our workloads, many of our so it would be an ideal balance between what you do on premise, what you do in the cloud, uh, eh, uh, looking into aspects, looking various things into consideration. Some of the things are better done on premise, some of the things are better done in cloud, and that uh, mm, evaluation we are doing in our organizations, and likewise most of the pharma companies have done it, or they are in the process, and eventually they would go past that journey.
Oh, great. So I think it's an honest admission that not much of the data is right now in the cloud, but going forward it will be, because that's going to be the demand of the time and business both. So Sandeep, due to paucity of time, I will come to you for one last question, which is going to be an amalgamation of a few questions. So you spoke about continuous data protection in nutshell, and thanks that you even then you subtly explained what it is all about and how Veeam has gone beyond just that and talking about cloud data management. So I'll stay with that thought. How is Veeam helping customers, adopting cloud? We see pharma companies adopt cloud for a long-term retention and want to go tapeless and not compromising on compliance and governance needs. So what's your thought on that? Can you please unmute yourself, Sandeep?
Yeah, so like what Atanu pointed out, that hybrid is going to stay. It is not that all the workloads will move to cloud, at one go, and organizations are evaluating their cloud strategy in a very serious way. Whether to drive agility and or to drive revenues, look at a faster time to market. The risk that these initiatives pose, not to the data, but so much to the availability or the uptime is, particularly, when you're migrating these workloads, right? If you move workloads from, let's say, on-prem to cloud, customers are concerned about how do you protect this data or these workloads as they move to cloud. So backup and protection is an important element of cloud strategy. Just like you feel much safer you have when you have a seat belt on as you're accelerating on an highway. Organizations get more confidence to accelerate on their cloud journey if they have the right availability strategy. And that is why I believe that CIOs today are looking at backup not from the backup standpoint, but from the standpoint of availability and resiliency. Atanu also spoke about ransomware attacks. So there has been 800% increase in the ransomware
Yes.
attack in the past 12 months.
I agree. Yes.
Can you build the last line of defense against the ransomware? Because let's understand one thing, that whatever security measures we take, IT takes, you still have to be ready for a ransomware attack. And what Veeam has been able to help its customers with is to build that last line of defense. Because what we advocate and recommend to our customers is to have a 32110 policy.
Yes.
In brief, you create 3 copies, two in different, two of them, in 2 different medias. And when you send that 1 copy off site, it should be a completely immutable backup.
Absolutely.
Now, whether that backup is on cloud, that's the organization strategy. You could either put it on cloud, you could bring it on prem, but it has to be completely immutable. So in case of a ransomware attack, you are able to recover all of that data. We are helping organizations build that last line of defense. While all of this is being kind of driven by IT, I think one element which is also important is about compliance and reporting, and particularly for the healthcare industry, which is so much regulatory and compliance driven. You need to make sure that when you're accelerating on your DX, you still are able to give your internal auditors and external regulators the confidence that you are securing all of that information. And that can be delivered when you have one single availability platform that can get you the view of data which is on-prem, in cloud, in multi-cloud, wherever it is. Simple things like O365, we all realize, and IT does recognize that all of that information is very critical for organizations today to protect, because it's a joint responsibility. It is not, Microsoft's responsibility to protect all of this information. It is the responsibility of the customer as well as the SaaS, the service provider here. We are seeing also emergence of backup, or the need of backup for endpoints, which was not so much earlier. And like Atanu pointed out, even this factory floor today could be handled remotely. And when you're trying to do that, the elements or the risks that are being posed are something that we got to control. Now, when you're driving all of this, there is a need which is coming up to protect the endpoints for your users. And organizations have tens and thousands of employees all over the world. And how do you protect their information? Do you want to make it an operational behemoth and then unmanageable kind of project, or want to put it on cloud and make, or drive backup as a service, make sure that anyone can back up their data from anywhere and put all of their data on cloud? So Veeam has been basically advocating and leading this journey of backup and availability transformation across the industry, including healthcare. And this is the scope of, I would say, the cloud data management, to put simply.
Okay. I think, I wish I could extend this conversation a little bit more. However, in the interest of time, and I have spoken at length with both of you, and you have expressed yourself quite freely. So thank you very much, Sandeep. Thank you very much, Atanu, for sparing time for this session. And I'm sincerely hoping that those who are listening to this will certainly learn from it. Thank you very much.
Thank you. It was a pleasure.
Thank you very much, Atanu. Thank you.
Thank you, Sandeep. Thank you, Rahul.
Thank you very much. And over to you, Ashwin.